Hello, everybody. My name is Danielle Wheelwright. I am the Program Director for Stroke for the Mount Sinai Health System, and I'm joined with Stephanie Arbelaez,
Hi,
who is
everyone.
our amazing Mount Sinai Heart RNs. It is Stroke Awareness Month and Blood Pressure Awareness Month in May, and so we're going to spend the next 15 minutes or so talking to you about stroke, how you can recognize stroke, and how you can keep your own blood pressure in check. So I wanted to start off by going over some stroke facts. Number one, someone in the United States has a stroke every 40 seconds, and every 4 minutes, somebody dies of stroke. Every year, nearly 800,000 people in the United States has a stroke, and about 610,000 of these are first or new strokes. About 185,000 strokes, nearly a quarter, are in people who have had a previous stroke. Number four, stroke is really expensive. Stroke-related costs in the United States came to nearly $46 billion between 2014 and 2015. And this cost includes the cost of healthcare services, the medicines that we use to treat stroke, as well as missed days of work. And fact number five, the risk of having a first stroke is nearly twice as high for Black versus white individuals. And this disparity is due largely to the systems that are in place that put Black individuals and Black communities in circumstances that increase that stroke risk. For example, lesser access to fresh fruit and vegetables, lesser access to disease prevention, education, and strategies, as well as lesser access to healthcare in general. And it's really important that we work really hard to address these and improve this unacceptable statistic. So, what is a stroke? So, the same way that we think about a heart attack, we think about stroke. Stroke is a brain attack, and it occurs when blood flow to a certain area of the brain is cut off or disrupted. And when this happens, brain cells are deprived of oxygen and nutrients, and they begin to die. The symptoms that you see during a stroke depend on where that disruption of blood flow is occurring. And some common symptoms that we see in stroke are weakness, muscle weakness, loss of sensation, disruptions of speech. And there are two types of stroke: ischemic stroke, that is the majority that we see, that's about 85%, and then hemorrhagic stroke, they make up the rest, 15%. So just taking a little deeper look into ischemic stroke, that occurs when one of the arteries in the brain becomes blocked, and that's usually by a blood clot. And this blood clot or blockage can form inside the brain, or it can form outside of the brain, like in the heart or in the carotid arteries in the neck, and travel up and get lodged in one of those brain arteries. And like I mentioned, ischemic stroke makes up about 85% of the strokes that we see. Hemorrhagic stroke occurs when blood from an artery begins bleeding into the brain. There are two types of brain bleeds. You might hear them referred to: intracerebral hemorrhage and subarachnoid hemorrhage. And then we have transient ischemic attacks, and these are sometimes referred to as mini strokes or TIAs. These are your warning signs. These are really important to get looked into if you think this might be happening to you. It's the same process as an ischemic stroke, where we have a little clot causing a blockage in one of the artery. You see these symptoms, but the body breaks down the clot before any permanent damage occurs. So sometimes these are ignored, but as I mentioned, this is really a warning sign and should be taken really seriously. So absolutely call 911 if you notice any of these symptoms happening. So every minute that somebody is having an acute stroke, 1.9 million neurons die. So we really need you to move fast if you think that you or someone in your community or your family is having a stroke. So how do we recognize stroke? How do you know or think that someone might be having a stroke? When we talk about stroke recognition, we talk about be fast. This is an acronym that we used where each of the letters in be fast represents a different sign or a different symptom that you might see in acute stroke. So the B stands for balance. So if you notice any really sudden loss of balance or incoordination, maybe inability to sort of hold their cup, things like that, you should think about stroke. E is for eyes. So any sudden loss of vision. Are you noticing that your eyes or someone in front of you's eyes is moving to one side and they can't move their eyes? Think about stroke. F is for face. So this is a really common one that we see in stroke. You notice is facial droop. So, is one side of their mouth sort of drooping. Ask them to smile, or you look in a mirror and smile. And is there any asymmetry, sort of flattening of this area on one side of the face? A is for arms. It's also for legs. Are you noticing any weakness? Weakness on one side of the body and also loss of sensation. And then we have S. S is for speech. Are you noticing some slurred speech? Are you noticing some inability for the words to get out? Or maybe the person is having some trouble understanding you. And then T is for time. Like I mentioned, neurons die really fast in stroke. It is time to call 911 as soon as possible and get to the hospital. So I'm going to hand it over to Stephanie, who's going to go over some risk factor control and go over some blood pressure monitoring tips.
Thank you, Danielle. Hi, everyone. So on this slide, we're going to talk about life's simple seven is what we call it. These are just measures that you can take to sort of minimize your risk of having a stroke. The first one being, and very important, is don't smoke, or if you do smoke, let's try to make a plan to quit smoking. Second is be physically active as much as you can. The point is to really just be moving. Try to set aside 30 minutes a day if you can to just moving, whether that's walking or biking, or 3 to 4 times a week of 30-minute activities, just really moving and being active. It's very key. Another one that's important is to really control your blood pressure. You can do this by monitoring and sort of controlling that sodium intake, so we're not taking over the daily required amount, and also controlling your cholesterol. As Danielle was talking about these different types of strokes, controlling your cholesterol is extremely important as well. And you can do that by controlling the intake of saturated fats that you consume. And next, really maintain a healthy diet. This can be done by really making sure you incorporate vegetables and fruits into every meal. And another key one is to reduce blood sugar. Those who have uncontrolled blood sugars really quadruple their risk of having a stroke. So those who are diabetic, really monitoring your blood sugars and taking your insulin and medications appropriately. And those who don't, really just on those annual physician visits that we're really just checking to see what our blood sugar is. And lastly, maintain a healthy body weight. This is, everyone has their own different healthy body weights that's designated by your doctor. So really just maintaining your weight or getting to that goal that you should get to. All right. Next, let's talk about high blood pressure. Sort of what is it? What do the numbers mean? A systolic blood pressure, which is that upper number, refers to the amount of pressure in your arteries during the contraction of your heart muscle. Again, this is your systolic blood pressure. Your diastolic blood pressure is that lower number and refers to the blood pressure when your heart muscle is between beats. Again, this is called your diastolic blood pressure. So what is a normal blood pressure? Look within that green line at the very top across. So a systolic blood pressure is less than 120 and a diastolic blood pressure is less than 80. If you're within here, this is our goal. You're doing great. Sort of maintain your blood pressure control with your sodium intake and sort of maintain those lifestyles that you currently have. If you have an elevated blood pressure within the yellow range, So that would be a systolic blood pressure, again, that upper number between 120 and 129, and the diastolic less than 80. We probably should start thinking about maybe doing a little bit more lifestyle changes because you are on your way to hypertension. So maybe monitor that sodium intake. When we start getting into the hypertension stage 1 and stage 2, this is time to like consult a doctor, make sure that we may be prescribed blood pressure medications, but we really should start making lifestyle changes. Stage 1 refers to systolic blood pressure 130 to 139 and a diastolic pressure between 80 and 89. In stage 2, we have a systolic blood pressure, again, that upper number between 140 or higher and a diastolic of 90 or higher. When we start getting into hypertensive crisis, it's time to consult a doctor immediately. That might be like a sudden increase in blood pressure that occurs after several readings at home. And this is something that you really should consult your doctor about. And this is a blood pressure systolic higher than 180 and or a diastolic higher than 120. Okay, so how do you monitor your blood pressure at home? It's important to get an accurate reading. So these are some steps that you can take to monitor your blood pressure and get more accurate reading at home. The first thing is try not to smoke, exercise, or drink caffeinated or alcoholic beverages 30 minutes prior to your measurement. Again, doing these things might increase that blood pressure and give us sort of a false high reading. Make sure that you're nice and relaxed. This is key. Sit still in a chair with your feet flat to the floor and your back straight and supported. Next, make sure when you're in the chair, you're just resting for 5 minutes, again, relaxing. If you are using your left arm, make sure it's resting comfortably on a flat surface and level with the heart. Make sure to sit calmly and try not to speak. We'll talk a little bit about cuff size in the next slide, but make sure that you have a proper cuff fitting and that that bottom portion of the cuff is at the bend of the elbow. Make sure the device you're using at home is properly calibrated. And again, we'll talk about cuff size, but making sure you have a proper fit is very important. Lastly, take at least 2 readings, several if you can, at least 1 minute apart. And it is key to sort of take your blood pressure at the same time every day when you are deciding to take your blood pressure. So that could be in the morning before your medications or in the evenings before dinner. And make sure that you're recording all your results. So just so you can remember them and have all your numbers available. In this slide, we're going to talk about proper fitting of a cuff. It is important that you are choosing the proper cuff size. A cuff too large may be giving you a false low reading, and a cuff size too small may giving you a false high reading. So here is a great picture of a proper cuff fitting. Again, that cuff is, the bottom portion is at that bend of the elbow, and we want the cuff size at least to cover 80% of the arm. That means between the shoulder and the elbow. So we don't want anything smaller than 80% of that distance or anything larger than that. So again, about 80% of between the elbow and the shoulder. The last thing is that inflatable portion of the cuff, or what we call the bladder of the cuff, should cover about 40% of the circumference of your arm, or just all the way around your arm. So no more than 40%. And I'm going to pass it back to Danielle. Thanks, everyone.
Thank you so much. Okay, so wrapping up with some key takeaways. Stroke is an emergency. So learn Be Fast, know Be Fast, teach your friends and family and community members what Be Fast is, and call 911 as soon as you recognize any sign of stroke. Know your numbers, check your blood pressure, speak to your PCP, know your cholesterol, your weight, and have a plan with them and work with them to reduce your stroke risk. And of course, eat a healthy diet and exercise regularly. And that's going to really help to reduce the risk of stroke and a whole bunch of other diseases as well. And you'll notice here we have an email address down the bottom. If you have any questions, you want to clarify anything, please don't hesitate to reach out via this email, and one of our team members will get back to you. So thank you so much, and happy Stroke Awareness Month.